Just a little bit of background stuff first, because my roots and my organisation's roots are in the health sector. So we started off back in 2013 a platform, online platform, to help GP practices, in particular in Australia, deal with business continuity planning. So everything from major events such as bushfires, storms, then we moved into a bit around cyber because it was obviously an issue, and then there was quite a big section on pandemics. So pandemics in particular were very much focused on influenza. So I'm going to show you some slides in a little while about influenza, because that is still going to be a continuing issue for us, even though we've got COVID-19, which has obviously reared its head in more recent times. But it won't be the last time we get a pandemic coming through. So I wanted to thank Craig and Ian for the opportunity to talk to you all today. And I'm just going to go through some content around particularly some of the risks that businesses face, and then focus in on the pandemic stuff, infectious diseases. Okay. So in terms of the agenda, what are the risks that businesses need to prepare for? We're just going to have a quick look at that, and it's about resilience. And Jonathan mentioned a little bit about cyber. When you're dealing with SMEs, whether it's in the health sector or in small to medium businesses, the cyber security literacy is very poor in many cases. So having a platform where we can actually lead the small organisation through the things that they need to think about and put in place, in my view, is a good thing. And getting some of those basic things in place is really important, because most organisations we talk with, they're quite complacent. They never think things are going to happen to them. So it's about ensuring that their resilience is really up to scratch. So as I mentioned, a focus on some of the business risks, and then we'll look at pandemics in particular. So if I look at some of the business risks in particular, cyber attacks we've mentioned, still in the top 10 concerns of directors of organisations, and will be for some time. Then you've got other things that we deal with in our online platforms. As I mentioned, started off in the health sector, so for small to medium GP practices in particular, and we work with about 2,000 of those organisations across Australia, some in New Zealand, but then with a lot of small to medium organisations here as well, in sectors right across different facets of business. So threatening behaviour is becoming a big issue, particularly in the health sector, and something that we need to be aware of. Flooding, severe weathers, cyclones, bushfires. End of 2019 in Australia, they had a major bushfire season that you'll all be aware of. Many, many people lost lives. You know, back in 2009, they had the Black Friday bushfires, and 178 people lost their lives. So it's a major concern in Australia. So these things make business continuity planning more top of mind in places like Australia, and they should here too with the earthquake risk. So then we've got heat wave, we've got pandemics. Now, who would have thought we would be where we are now? And it's basically changed the focus of how businesses operate. And then you've got other things. I mean, we never lose power in Auckland, do we? So you've got to prepare for these things. And it's not the fact that you're going to mitigate them happening, you won't. It's about how you respond and bounce back from each of those events. Okay, so I won't dwell on this too much. When you look at the ResilienceTec platform, that's designed for small to medium organisations across sectors. And so, oops, I've also had a denial of service attack across sectors, and it really goes through and takes the small to medium enterprise through a series of modules or steps that they need to think about because they haven't got the expertise to do it. And it's like having somebody sitting on your shoulder that can guide you through. So if you have got an organisation that you work with that you would like to have a BCP or an emergency response plan put in place, then talk to the Delta folks and they can help you out. There is a particular focus in this platform around cyber security and making sure we get the basic hygiene principles in place. Things like password policies, things like bring your own device policies into the workplace, things like backups, right? Because I've walked into many organisations and they don't even know that their systems are getting backed up or where. So it's making sure that those things are put in place. Now, moving on to onto pandemics, because it's an area that we focus on. I sat down, it would have been about 3 months ago, with some colleagues, and we said, right, let's come up with a list of stuff that we know in terms of infectious diseases over the years, of which there have been many. Now, the one that is most often compared with COVID-19 is what they call the Spanish flu, and I'll cover that in a minute, and that was in around 1918. And that affected 500 million people worldwide. So a third of the world's population back then. Massive, right? And it killed many, many people. Then we've had plague, we've had H1N1 that you'd be aware of, that originated in Asia as well and then spread internationally. You had SARS, you had yellow fever, and so on and so forth. Interestingly enough, smallpox is the only infectious disease with human intervention that has been eradicated. So now that we've got COVID-19 in place, and you've probably heard all the data internationally about the vaccines, right? And we're not doing too well in the vaccine rollout scenario, as many of you will know. In fact, I heard figures the other day that we're ranked about number 100 in the delivery of the vaccines through our population. That in part is because we've been very lucky in terms of being isolated and the way the government's managed it. But if you think about the UK, I also heard some interesting stats the other day from the UK, because you can remember they were in dire straits a year ago, many infections. Well, they have now rolled out 50 million vaccines, and they had 1 death on Monday night related to COVID-19. So they've done a phenomenal job of rolling the vaccines out. So I hope I can get a vaccine shortly, and I know there'll be some people that'll be hesitant, but you know, it's a fact of nature. If we want to travel again, we will be likely have to have one to actually get on a plane. So it is important. I also put down there in terms of some more local things that are more local. So things like measles. We had a major outbreak with measles last year and the year before. And some of those measles patients actually went to the islands and caused havoc over there. So it's a major issue we need to watch. Whooping cough, resurgence in STDs that you see in hospitals, you know, things that you would think had been, you know, long gone, eradicated, but are still out and about, rearing from time to time. And then obviously COVID-19, major issue. Okay. So what's a comparison between COVID-19 and influenza? So the viruses are similar in their presentation. They cause respiratory distress, and they present in the form of asymptomatic or through mild to quite severe symptoms and death, particularly around COVID-19, as you're all aware. So they're transmitted by contact, by droplets, and by fomites, right? And as a result, the same public health measures are applicable to both viruses. So that's about hand hygiene. It's about making sure that you have distancing. And what you'll notice, and it's really interesting, I was looking at the stats from ESR the other day around influenza in this country and what's happened to it over the COVID-19 outbreak. And you can probably guess. Any guesses? It's flattened completely, and I'll show you that in a minute. Okay, so if you look at that graph, you can see the years 18, 19 and 20 in terms of influenza rates, and the yellow, or the gold, is the influenza rates for 2020. Now that's kind of, when you first look at that, you go, wow, that's incredible. But if you think about, most of us were working from home. We weren't in physical contact for long periods of time, because you'll see it's seasonal over the winter months in particular. And it will continue that way probably now, because we're much more aware of, pandemic etiquette, coughing into your elbow, making sure you're washing your hands regularly or using hand hygiene products, staying away from people when you are not well. In fact, it's very much frowned upon, isn't it, if somebody's got a cough to end up in the office. And we're kind of lucky that we can get back into the office. I was talking with some customers in Australia yesterday, and they're all in Victoria, and they have not got back into the office yet, and they went into lockdown at the end of March last year. So they're still working from home. So we're very fortunate to be gathering in an event like this to start with. We should be very grateful of that, because there's a whole lot of things around resilience that also brings, because we heard Craig mention mental health issues, which are a major problem during this whole COVID-19 scenario for many, many people. Domestic violence has gone up, which is another big issue that we're having to deal with, a lot of social issues coming from it. And another thing for small to medium organisations around resilience is corporate culture. Because if you're all working from home and you're not bringing people back together from time to time, your culture suffers as well. So it's important as an organisation to try and keep resilience and keep that balance going. So quite often now you'll hear of organisations that will have flexibility around Monday and Friday, but we expect you to be in the office Tuesday, Wednesday, Thursday, as an example. And that way, at least you've got, you're helping deal with scenarios for individuals, but you're also trying to keep the company culture going as well. Okay, so what are some of the things you need to think about as an organisation relating specifically to COVID-19 as we go through this whole process? Staff roles and responsibilities. In dealing with GP practices in Australia, they're far more in tune with some of this stuff than most small to medium enterprises are. So staff roles and responsibilities, having a pandemic leader in place, somebody that can actually take the reins and make some decisions about what happens when certain events occur. So if you have somebody exposed in your organisation to a COVID-19 patient, hopefully they get traced, but then what do? Do you then send all your people home? You'll get directed by the public health units for sure, but you also need to act as an organisation and prepare for that stuff and have somebody that's responsible for it. What we've got in the ResilienceTec platform is we have the impact of an infectious disease on a small to medium organisation. And in that, it's about making sure that you decide on who your pandemic leader is. Very important. And who the backup is for that. And then staff rostering. What do you need to consider from a staff perspective? One thing we know for sure now is that, and not many organisations do it, but you need to know who in your organisation has either elderly living with them at home or has people living with them that are immune compromised, because they may not be willing to either come into work or work in certain situations. And you need to know that and you need to record it. And exactly the same way, you should be recording things like immunisations. Okay, now as an organisation, our organisation, which is about 14 people, we're quite small, plus our tech team, we know when everybody's been vaccinated. We suggest, you can't make it mandatory, but we suggest people have a flu vaccine every year. And I think what's going to happen going forward now with COVID-19 is once you've had your 2 jabs of the Pfizer one, which is what we're going to get, then each year you're probably going to have a booster because the variants, as we've already seen, will change. So record those so you know, particularly if people are travelling. It's a really important issue. So have an immunisation register. What about infection prevention and control? So what have you got in place to deal with that? I mean, we all know that part of the the mandatory things the government asked us to do was to have the QR code so that when people come into your organisation, they scanned in, all to do with contact tracing. But then you need to have other things. So if you're in a retail business, you need to have designated floor markings where people stand, right? You need to think about the same kind of thing within your businesses as well. And it may not be to the same degree, but you need to think about physical distancing. You need to think about working in small spaces with a number of people. You know, you don't want to put your organisation at risk because it's about making sure you keep your business going, right? And then having things like cleaning policies. Okay, so what I did here is I grabbed a section out of the ResilienceTec platform just to show you some of the stuff that we've got in there. So I won't dwell too much on this, but you can see we've got a lot of, there's a lot of recording of things like staff training on how to put on PPE gear in certain organisations, but also things like, as I mentioned, the distancing and the hand hygiene, and making sure you record immunisations, and making sure that you've got a register of who's living with your employees so you know their status. Those are all really important things to understand. So there's an example there of the who's willing to work, the status, the immunisation register, which we've already included the coronavirus vaccine in there as well as part of the platform. So it's a lot of pre-populated information that the organisation can change and edit at will, but at least it gives them some prompts to think about what they need to include in there. And we sit down with organisations and we coach them through some of the stuff as well, what's important and what's not. The other thing that's really interesting too, and this came out of our work in Australia as well, that in New South Wales and Victoria, it's mandatory now to have a COVID safety plan in place for any organisation, no matter who you are. Whether you're a GP practice or you're a takeaway shop down the road, you have to have a COVID safety plan in place. And those things are really, you know, making sure that you've got the well-being and the safety of your staff, your clients, and any contractors that come in contact with your organisation. And what do you need to be putting in there, right? And it's about having leadership in place there as well. It's making sure you have people flow in and out of your organisation, so you limit entry. It's defining foot traffic. It's displaying information on the door about entry. It's really that basic stuff. That's really important. So I know I've whipped through this quite quickly, and I didn't want to get too much into the detail. But if we think about the resilience of any organisation now, the times have really changed. If I look at the COVID situation now, and I look at it Australia in particular, when I looked at the figures yesterday, up until now, there's been 910 deaths in Australia from COVID-related illness. If you look at influenza, the worst year in Australia was 2017. There was over 2,000 deaths related to influenza. So I think it's mainly a factor of this, and you hear everybody talk about it. It's a tricky virus. Because it's a tricky virus and it spreads really quickly, people are much more reliant to take on information from public health units and from governments to do certain things. When there was just influenza around, people weren't so much. People would turn up to work and they'd be coughing and spluttering everywhere. That's not accepted anymore. So I think what you've got now is you've got a step change in terms of the willingness to do things and to be a bit more careful about how we work in the workplace and in our private lives. So yeah, I think we're in a really good position, and I think with the vaccine getting rolled out, and hopefully it's all of us by the end of the year, no guarantees, we'll be kind of back to business as usual in part, but never back to what it was. And it's about increasing that resilience, it's about understanding about how your organisation should work so that you can protect your income, you can protect your staff members, and you can protect the reputation of your organisation. So with that ado, I think that's probably it for now, Ben.